New videos every day.
Life, wisdom, Psychetruth, massage.
Hi everybody, this is Gregory Gorey with bodyworkmasters.com, and today we're going to talk about shoulder injuries using Soma cupping to bring some relief. So there are a number of things that can go wrong with the shoulder joint. It could be a neck impingement, it can be the shoulders are too rounded and the pecs are too tight, it can be a weak lower trapezius. There are a number of factors that can be at play. The beauty of the Soma cupping is that you're basically releasing all of the tissue that surrounds it. So we're going to turn this into two videos. The first video, we're going to release from the upper arm up into the deltoids, across the pecs, and maybe get a little of this upper trapezius. Then we're also going to want to get into the rear delt, the lats, and the serratus muscles. So we're going to start off a little oil or lotion to get the cups to be able to slide. We're going to come here. We're going to go down the arm there. We're also going to be releasing the sternum here. I've already gotten permission from my client to do that. You need to check in to make sure that that's going to be okay. So we're going to start off, this is a smaller area, so rather than taking the bigger cup, we're going to move down into these smaller sizes. And I like to use the biggest cup that I can. You'll get the most suction, but if it's constantly popping off because of the contours, then move down to the smaller cup. So we're going to start off with just a little suction in there, just tiny. You can already start to see the blood rushing to the area. Is that okay? Is that within your comfort zone?
It's a lot.
It's a lot? Okay. Then what we're going to do, that was fairly light pressure, so we're going to desensitize the area first. We're just going to take the cup and we're just going to warm all of this tissue up. Coming in here. Boris Prelutsky, I apologize if I'm butchering his name, talks a lot about this, about the importance of just trying to get the nervous system to calm down and starting off with real light pressure, and if even that light pressure is too much, to just get the nervous system calm. What's also nice about these cups is that you can go in and actually massage the bone, which periostal massage is very rarely ever done. Sometimes we'll come up to the bones and release the attachments, but the bones themselves respond well to direct massage if done properly, and these cups are soft enough that it won't irritate the tissue. I'm going to stimulate the fibroblast production. Sometimes you have little mini cracks and fissures in the bones that need to be released. Okay, so we're going to try that again. Small, teeny tiny amount of suction. Is that okay? Did it get easier from the first time? Yeah, good. Good. lotion here, or oil. I'm going to get the bicep insertion here, coming down into the bicep. Those small light circles. It's a little more challenging when working on the arms or the lower leg and the feet because when there's contours, it's easy to lose the suction as opposed to doing the back or the legs, upper legs. But just find the right cup that will stay on there. The back of the arm a little bit. Start to see the blood flowing into this area. Good, back and forth. There's actually a slight amount of, you can use the cups with a lift, which will actually create more torque, but because because we're doing this gently, we're only putting on the 1 to 10 scale about 2 or 3 degrees on that. So instead of full compression and maximum suction, we're just doing a gentle little tug. You really can't pull off of the muscle, but you'll still get a suction just naturally because of the negative pressure that these cups are creating. So there's actually more of a push down so that you maintain contact. Good. So we got the upper arm here. We're going to go across the pecs. We're going to get this clavicle and all the attachments of the pecs on the clavicle here. And set your arm right there. Is it still okay? Not too intense? It's a little rough? Okay. Let's warm that up more then. And also, right now I'm not doing any suction at all, but it's an unfamiliar feeling for most people to have something rubbing up against the bone. But as I said, it can be really beneficial. So just a small amount of suction, very slow, small circles there. Across to the sternum. going to move the arm back and get into the pec minor a little bit. So let me have you just put your arm right there. Pec minor inserts here, one head here, one head here, one head here. You're also, when dealing with a shoulder injury, you're going to want to get the lats down here and the serratus muscles. Basically, you want to take the body, if you're dealing with a shoulder injury, and go this quarter, the back quarter, and then down through the lower arm and up into the neck. So we're going to do right there. Is that okay? Now with a little bit of suction. Getting the attachments there. You can actually even get into the armpit itself if your client isn't too ticklish. She's laughing already. We haven't even touched her. She's laughing. But we're going to try this, okay? There you go. The armpit is important because you can get into the subscap this way, which is a major rotator cuff muscle. So we're just going to do light. Good, big breaths. Okay.
Okay.
All right.
We got this.
We got this. Sometimes this happens. Sometimes in the name of massage science. Yes. So just coming right there. So coming with the cup, no suction, just desensitizing this. Oftentimes ticklishness is actually a sign of dysfunction. Sometimes it's a psychological thing, but if there are spots that you find with your client and they like getting anywhere near them and they go, whoa! Oftentimes what that is the brain knows that there's tenderness underneath there, and it's a defense mechanism. So we, rather than say, press me there and I'm going to be like, ow, we go, oh, get away. But if we can, she's already starting to calm down. We started, just the act of doing this is starting to desensitize the tissue. So, you're doing good. All right. Okay, so just, it's now, she's not jumping off the table anymore. We're going to do just a little bit of light suction. Okay, good. Slightly smaller cup. And if you're squeamish about getting into the armpit, one of the things that you can do is just get some rubbing alcohol beforehand, put it down, or if you're working in a spa setting, you've got hand sanitizer, that'll kill all of the bacteria, and there won't be any odor. She doesn't have any odor now, but if that were a situation that comes up for you, there's a simple solution for that. So as I'm looking, I'm seeing that this got nice and lots of blood flow. This got lots of blood flow. This area and here, there's one area right through there that hasn't gotten there. So I'm actually just going to set that there for a second, because that seems to be an area where she's still a little jumpy there. There, and now you can start to see the color of the blood rushing into that area. So I'm going to wipe this off a little bit, and then we're going to get into her upper trap. Upper trap right here. Yeah, let me have you turn your head a little bit. There we go. And so a lot of times people talk about doing myofascial work or using these cups for myofascial work, and it's excellent. It's the best tool that I've found to do myofascial work. But it's not just about the fascia. We're actually, by creating separation and bringing blood flow and relaxing these muscles, we're also improving nerve conduction, and we're stimulating mechanoreceptors and proprioceptors. Basically, this is a shotgun approach to loosening the entire complex. So, when we were at the beginning of the video, we were talking about, well, shoulders are pretty complex. For me, it's easier to deal with somebody that has low back pain than somebody that has shoulder pain, because, there's so many ranges of motion. But if you can go in and do the shotgun approach and release all of the tissues that surround that, improve the blood flow, improve nerve conduction into the area, when you're done with it, then you can go back and say, okay, well, what's left? Is it raising your arm? Is it, what has improved and what hasn't? And do a little bit more here on this upper trap. Can actually take it all the way up into the neck here. Get my smallest cup. Across the clavicle again. Good. All right. Well, there's more work to be done. The other part of this would be to have her turn over and on her back. We did some videos about releasing the back, but there are specific things that you can do for the shoulder, and we'll tackle that in the next video. Hope you enjoyed it. Please don't forget to like and subscribe, and check us out at bodyworkmasters.com. If you have any interest in taking a continuing education seminar, I'll post info about upcoming events. Thanks.